My name is Angelica Francis, and I'm a registered nurse that works in the operating room.
My name is Connie Vonyer, and I work at SGMC Health on pediatrics.
My name is Debbie Adams, and I'm a lead land tech.
My name is Don Luke, and I'm the administrator of SGMC Health Smith Northview campus.
My name is Kelly Brogdon. My job title is Secretary for Pulmonary Services, and I'm also EEG Tech 1.
My name is Sandra Smith, and I'm a nursing assistant.
Hi, my name is Vernon Jackson, and I'm an interventional technologist. I've been at SGMC Health for 40 years.
I have been at SGMC Health for 40 years.
I've been at SGMC Health for the last 35 years.
I've been working here for 46 years.
I've been at SGMC Health for 35 years.
Lois Will, September, I'll be here 36 years.
I have been at SGMC Health for 45 years this past May. I was born here at that time, Pineview General Hospital, which is now SGMC Health. As I say, when I'm asked, I was born here at Pineview General and came upstairs to work. I work with our outpatients on scheduling, with the pulmonary function, sometimes the EEG and sleep lab. I tell them I'm the mom of the department, that anybody that works here in any department, not just ours, I have a chair in my office that you can come in, we'll sit together, we'll talk, we'll laugh, we'll cry, whatever the case may be.
My day-to-day role is like an air traffic controller. I open up the operating room first thing in the morning. I'm there at 5:30 and get surgery started and start coordinating as a liaison between the operating room and the floors.
I work on pediatrics, and I'm a staff nurse there. And we take care of all the community children, the sick ones that come in.
When I first started in '78, I was a data entry clerk. And then I proceeded to a computer technician. Then I went to a land technician, and now I'm in the lead land role.
I would say that my role is to provide leadership and direction for the team that works with SGMC Health.
I help the resident do anything from listening to them, reading to them, feeding, bathing, whatever I can assist the resident with, that's what I do.
I specialize in vascular work. I've worked for years with the radiologists, and we primarily work with dialysis patients. As a supervisor, it's a totally different role because there was a long time where I was just one of the staff technologists and I didn't have the responsibility that I have now. Through time and experience, I've learned to embrace having that role as a supervisor.
When I first started here, we were on those 96 column cards, and I had to walk around the whole hospital. I'd have to go to collect all the paperwork. Then I had to get back, I had to key it all in manually. And then when we went to the EMR system of McKesson and now Epic, everything's pretty much computerized.
We used to do all paper charting. The doctors would write all the orders on paper. We would transcribe them, fax it down to the pharmacy, and all this was hand done. So it's a lot quicker now with the computers.
Technology has advanced so much. Anesthesia, surgical procedures. I've seen the evolution of the GI lab out of the ER. I've seen the evolution of outpatient nursing surgery out of the ER.
Well, when I first started with SGMC Health, I was a phlebotomist in the laboratory. Worked my way up to supervisor and then eventually manager of pathology services, and then director of operations for this facility and eventually administrator of the facility.
My job since I first started was we only had respiratory therapy. We now have added the EEG department to us, pulmonary rehab, and the sleep lab. Love the smash burgers. If Lee Curry cooks them, he is the best.
My favorite meal is actually a patient meal that they don't really serve too much in the cafeteria, but it's a pork chop, turnip greens, and a sweet potato.
My favorite SGMC Health meal is fried chicken.
I used to love the clam chowder soup. Every Friday I could depend on that, but they don't have it anymore. I'm not sure why.
Back when the Allspice used to do the waffle bar. That was my favorite for sure.
Probably the dressing, when they do the dressing, Thanksgiving.
Well, I have to say I really enjoy the fried chicken on Wednesdays. That's probably one of my favorites. And believe it or not, I do love the meatloaf. My most memorable moment is working with the different schools that come in. I've been a great part of the tours for years, probably over 30 years. I've even went out on career day and worked with the different schools and been a part of career day, and it's just been so rewarding to work with the youth in this great community. It's been a blessing.
I was able to work with my father. He was the orthopedic surgeon. He started at SGMC in 1972. That's how he brought us down here. And after I finished nursing school, I was able to take care of his patients post-op in the recovery room.
I have a lot. It's hard to pinpoint one, but every year we would get money from an organization. It was a hunting club, and we would get to go shopping at Christmas for these needy families that we would take care of, and delivering those Christmas gifts to those kids that had nothing. That was pretty awesome.
During hospital week, we would do bed races. Departments would decorate hospital beds, and you'd have a person in that bed. And they'd close off Cowart Street, where the emergency room and the parking and all is now. That was a street, and that's where we would race.
Like I say, it's all about the residents, so it's a memory moment when I can go in there and help them. Just maybe calm them down for, don't know how their day went. Just go in there and calm them down, or just go in there and make them smile. When I come at work at night and I go check my residence room, and some of them are still awake, they'll say, I'm so glad to see you. And I put a smile on their face. And when they say, I'm glad you got me tonight, they put a smile on my face. So that's rewarding to me. I make a difference.
What I'm mostly proud of is that we were able to take care of our patients in the community in the fullest and give them the best care possible through the technology that we have and the services that we offer.
If I'm in town and this happened just the other day. They said, are you a nurse? And I said, yes, I am. And she said, well, you took care of my son 20 years ago. And if you get remembered after 20 years, you did something right.
How we responded as an organization to the COVID. I saw everyone come together, and not only SGMC health staff and medical staff, but the community as a whole. Everyone came together, being a part of that, being able to contribute in a positive way to that. That's definitely my most proud moment.
I'm a founder of CareShare, and CareShare has been going on for probably 38 plus years. CareShare has helped many employees here at SGMC Health through the years.
I'm enormously proud of my IT family because they've always been there for me through thick and thin. I could always count on them. And I think the great leadership and my coworkers has made it where you want to come into work every day.
I can remember when I first got hired here, I asked God to help me to be the best possible employee I can be. And by His grace, I have fulfilled that. I've been a part of serving this great community and the surrounding counties, and it's been a blessing.
It's just rewarding knowing as many people as our hospital touches that we've done a lot of good for our community and for our surrounding community.